Okay, and I think that's a good segue into talking about it because I mean I've known you since your life 2 days, but I know most people when you first tell them, "Oh, take your cell phone, scan your face or whatever for a minute, and you'll get all this health information." And I mean the two responses that I guess, and I mean I would have been there 5 years ago when when this was, I guess, when we had these discussions for the first time. But the two most common responses are bullshit. This is not, can't be real,
Mm-hmm.
or it's like this uber magical science. You know what I mean? So I guess if you can try
Yes.
and clear some of those misconceptions and explain a little bit without going into too much detail about how the science works and the fact that it's not a silver bullet, but that it is
Mm.
kind of, if not there already, it's very close to being comparable with the same type of medical test that we would traditionally
Yeah.
perform.
Yeah. No, so I mean, up front, I want to say that most of these technologies are still screening tools. It's not there necessarily to replace physicians, and then I'll go into the how now of how these things work. But having said that, there's been a lot of smartphone and wearable based C and FDA approvals. If you look at arrhythmia, if you look at certain voice and cough analysis for respiratory things, we see really strides there where there's CE marks and FDA marks for these things. So it's been under clinical scrutiny, and it's been found to be equivalent or similar to the medical tests. But I think, if I can just take a step back and say, okay, how do these things work, and why is it not magic? And then I also want to caution the consumer listening, if something sounds too good to be true, really scrutinize it. It probably is. So I think the scrutiny is very important. And I would rather err on making sure you properly scrutinize the technologies.